The window of tolerance. If we all have if there's a baseline of emotions, and then there's a lose it line where we flip, right? It's this flip. We have what's called the window of tolerance in between. So the typical, I've got a line there for, most of us, our typical baseline. We're not in parasympathetic all the time. We live in kind of a modern, fast-paced culture. So we have our typical line, baseline, and we have our lose it line. And the more stressed out we get, the higher our baseline moves toward the lose it line. Does that make sense? Our window of tolerance shrinks. So part of the work of healing is learning self-regulation, moving out of that sympathetic and into a calm, regulated state, one that we can actually be in our body for. These practices are going to help us increase our window of tolerance for stressful things. If we have trauma in our past, you can think of the adverse childhood experiences or even just our own community of having been through a fire, our baseline goes really high, right? It's up there. So just think about how we're, as a community, moving around in the world. How are we on the road? How are we at the grocery store? How are we when we're engaging with each other? I would suggest that right now all of our baselines are pretty high and close to the lose it line. And as the day moves on, our baseline moves closer to that lose it line, yeah? So all of these practices help us build our window of tolerance. It's our resilience window. That's what we're trying to do. We're trying to become more resilient in the face of all the things that we need to do and experience. PTSD. I put this up here because I don't know if all of you know or have done any sort of assessment of yourself, but in our offices at Roots and Wings, we were treating PTSD, right? Post-traumatic stress disorder. The difference, so there's something called acute stress disorder. An acute stress disorder is something that typically gets diagnosed within the first month of experiencing a trauma. And then after the month, that's when PTSD is typically diagnosed, right? The onset comes later. So you asked the question about moving out of endings, right? And then having symptoms, or we're being triggered by the smoke. We're being triggered by the rain. These things can bring later onset stress. So we were fine after the event. However it is that we've been programmed, our experiences, we all manage stress differently. Some people might not do well early on and heal and move through it. Others may be just fine and then later experience symptoms. So all of these are symptoms of post-traumatic stress. But the four major categories are avoidance. So are we avoiding places and people and situations? Intrusive memories, flashbacks, nightmares, right? All of these things occur. Changes in our emotional reactions and negative changes in thinking and mood. All of this is normal. The EMDR. So what EMDR is it's eye movement desensitization and reprocessing. And this is, I'm so happy that we have this, because we can actually go back and we call it unfreeze what has been frozen. So in trauma, you know how we go up, we move past that sympathetic and we go into freeze? Well, we eventually come down. But if we think about that meal metaphor, when we're experiencing a trauma, it's just too much, right? It's just too much for our systems to handle. We freeze, we come out of it, and we move on. But what has usually happened is that all of that information and that experience has gotten stored in our body. And with trauma, the experience does not get stored in an integrated way. It gets fragmented into raw sensory experiences, tastes, sights, smells, all of that. So it gets stored in a fragmented way, and it gets stored on the right side of the brain, which lives in the ever-present moment. It's our left side of the brain that lives in the compound present. It lives in the past, it's planning for the future, it lives in time, likes to divide things up. There's a fabulous TED Talk by Jill Taylor Bolton, I believe. She is a neuroscientist, and she had a stroke. And so she can describe in the most beautiful detail what happened when she had a stroke on the left side of her brain, and she understood what was going on. So trauma gets stored in the right side of the brain in a fragmented way. It's not been integrated, right? So we can be moving along, and something occurs and we get triggered. And when that part of the brain lights up, it goes right back as if it's happening now. Right? This is what happens with trauma. So what we do in EMDR is we actually are working with neural networks. So things need to be integrated. It was too much to take on, that meal, right? We couldn't quite do that. So we weren't sitting and able to process and be rational and logical, move through. So we go back in EMDR and we light up those networks, the memory networks, the neural networks. And then we provide something called bilateral stimulation. So we are tapping or using pulsars, left, right, left, right, left, right, to stimulate the nervous system and the two sides of the nervous system so that we can re-experience our trauma or whatever it was that we were going through. We can call that back up, and we can re-experience it in a safe place from an adult perspective. Right? So when we work with traumas from when we were little, there were a lot of things that were just traumatic to us then, but now we could handle. We can see them differently, but we often don't want to, right? And we've forgotten those because those are just stored in our nervous system. So we recall, we light up those memory neurons, memory circuits, and then we allow them to connect. The first thing we do, it's a three-step process. So when we do EMDR for trauma, first of all, we stabilize, right? So we have to be able to have a window of resilience, a window of tolerance, so that we are able to experience adverse things and handle that. So first we strengthen. Just like before you go into surgery, they're going to make sure you're strong enough for the anesthesia, right? So first we're going to strengthen and build resources, and then once we've got that, we're going to go in there and we're going to light up those memory networks and we're going to integrate those, right? So we ask, what's the image? What's the image that represents the most challenging part of what you're experiencing? What are your emotions? Where do you feel that in the body? And what do you believe about yourself? Because when we experience a trauma, there's an erroneous negative belief, right? I'm not safe. I'm bad. I don't deserve, whatever that is. And when we experience trauma when we're little, we don't even know that that's going in, but it's from there that we then move through the world, right? With these unconscious beliefs. So we call that all up and we reprocess with our intelligence and our wisdom and our strength that we have now, and we reprocess it. We remember things that we didn't remember. Oftentimes in trauma, we remember the bad stuff. And when we actually go through and start remembering what happened, we start to remember all, oh yeah, and there was this and there was that, right? So we actually are able to integrate this experience and come out with a new understanding of it. So how we refer to that is that we move from psychological, our experience moves from psychological memory to objective memory. So before, when I had that memory or I thought of that thing that I don't want to think about, my whole body experienced it as if I was there, having that experience again. And after we do EMDR and we process it, we're able to know, yes, I experienced that, it happened to me, it's part of my biography, it is not who I am, right? So from psychological memory to objective memory. Yeah, makes sense? We get to integrate it, we get to digest what we haven't been able to digest in our lives. We get to unfreeze all of that energy. So what's happened when we experience something like the fire is all of our experiences from our past get lit up, right? If we feel unsafe, something, and we felt unsafe at a point in time in our lives, all of that gets triggered. So we're not only experiencing the adversity of a fire and that change, but we're experiencing a lot of things from our lives. In EMDR, we talk about big T traumas and small t traumas. Big T traumas are those traumas, those events, those things that happen to us that were life-altering. Small t traumas are those moments of humiliation and shame or bullying, those things that we also all experienced, right? So we do a history so we understand somebody's life. The other thing about EMDR is that we actually go to the root. We do something called bridging. So we look at what are the symptoms. So EMDR is symptom-based. What are your symptoms? Because that's what we're working with. And we're going to work until your symptoms are gone. So we're not going to do psychoanalysis necessarily, right? We are working directly with what your symptoms are. What are you experiencing, feeling? Where is it in the body? And what do you believe about yourself? We work through that, and oftentimes it can generalize. So if we're able to bridge back to one of those formative moments, formative experiences, and we're able to clear that out and unfreeze that and move it through and digest it, you can generalize. So if your whole life has been based on one event that you had and you have been, working from that software program, it's possible that we can go in there, unfreeze it, and the natural intelligence of the system will just work through all of them. It's really, everybody's different, right? So no guarantees or promises here. But it's really quite fascinating to see what we high-functioning adults that have adapted well in this world can get tripped up on, right? Something that happened so long ago that we thought we processed, but some of it's still there. All right, so I'll just say this quote by Dan Siegel. Integration, it's the essential mechanism of health as it promotes a flexible and adaptive way of being that is filled with vitality and creativity. The ultimate outcome of integration is harmony, right? If we can integrate what we've experienced in our life, we can move into a place of harmony. The absence of integration leads to chaos and rigidity. So just a couple of words there for you to think about, right? The rigidity, it's real. There's rigidity and not being flexible can cause you and a lot of other people pain.